Well, as India undergoes this 21-day lockdown to fight the COVID virus and save as many people as we can, it turns out that there's one group of people that's particularly vulnerable. And that is the group that's undergoing dialysis treatment for kidney failure. According to data, there are 150,000 such patients across the country that are at particular risk at this point. Patients who aren't able to access the supplies and the medication that they need to simply stay alive. Now, I've spoken to doctors and to patients and NGOs that work in this area. There are two types of dialysis. The first one, the hemodialysis, is when the patient has to go to the center, maybe twice or thrice a week. Remember, not all patients in India are rich, and several of them use public transport. Public transport is not available. They aren't able to travel. Even if they do make it to the center is not properly staffed at this point and doesn't have access to the fluids, the medication and the supply that it needs. Dialysis patients, I understand, also need medication to maintain their blood pressure, to maintain their iron levels, and of course to maintain the health of their hearts. The second type of dialysis, which happens at home, requires a large number of fluid bags that have to be delivered to your home. Now, because of the kind of numbers that are required here in fluid bags, people don't stock for more than a week or 2 weeks. This is a 21-day lockdown. Home deliveries have stopped, particularly for these fluid bags. Remember, patients who are undergoing dialysis have very low immunity and are thereby particularly vulnerable to the virus as well. This is what a lot of patients had to say.
Most distributors in Delhi have stock only for 1 month, and a couple of them have had no stock, because of which they've had to shut shop. Now, this is a very serious condition because we require PD fluids for our survival. If we do not get the PD fluids in time, it can result in any sort of an emergency, and as it is, the hospitals are quite overcrowded with patients right now. Please help us.
And my father is a dialysis patient, and we are facing a lot of problems. Like, the center has shortage of supply in medicines, the staff has reduced, only 1 or 2 persons are available, hygiene has gone drastically down.
मैं पंजाब सरकार और स्वास्थ्य मंत्रालय से अपील करना चाहूँगी कि डायलिसिस सेंटरों में इस्तेमाल होने वाले ज़रूरी उपकरण जैसे डायलाइजर्स हैं, ट्यूबिंग्स हैं, दवाएं, इनकी सप्लाई नहीं रुकनी चाहिए, क्योंकि इनके अभाव में डायलिसिस पेशेंट को डायलिसिस नहीं मिल पाएगा और उनका जीवन खतरे में आ सकता है।
मैं एक सीकेडी पेशेंट हूँ और मेरी तरह बिहार में बहुत सारे सीकेडी पेशेंट मौजूद हैं जिनका वीक में 2 या 3 बार डायलिसिस कराना बहुत ही ज़रूरी होता है। हम लोगों का स्वास्थ्य मंत्री जी, मेडिकल ऑफिसर्स, मेडिकल सप्लायर्स लोग से अनुरोध है, रिक्वेस्ट है कि कृपया करके हमारे डायलिसिस में जो लगने वाले उपकरण हैं, डायलिज़र हैं और दवाएं हैं, उनका शॉर्टेज होने ना दें।
Now, doctors working in the area are particularly worried as they've received distress calls from their patients from across the country, patients who aren't able to access these life-saving drugs. Doctors have also warned us that if the patients don't have access to dialysis and their medication fairly soon, it could be a question of life and death. I spoke to one such doctor, Dr. Professor Vivekanand Jha, the Executive Director at the George Institute of Global Health in India. He's a James Martin Fellow at the University of Oxford, and he's the President of the International Society of Nephrology. He told me he believes that this is a problem the government needs to look into immediately.
In hemodialysis, the dialysis units need supply of regular dialyzers, tubings, and dialysis fluids. And since they are consumed in large numbers, they cannot have stocks that will last for several weeks. Typically, they have a continuous supply chain, and that has got disrupted, resulting in shortage of dialysis consumables in many places. Similarly, for patients who are on peritoneal dialysis, they require regular supply of peritoneal dialysis fluids to come to their homes. And many or some of the peritoneal dialysis patients would have run out of their supplies during the period of the lockdown. And once again, because businesses are closed, because transportation is not taking place, they will run out of their peritoneal dialysis fluid supplies, putting their lives in jeopardy.
Doctor, forgive me for having to ask this question at all, but how long do you think these patients can hang on without receiving this supply? Because we're already 5 days into this lockdown.
Indeed, that's a tough question to answer, but patients on dialysis require regular dialysis for prolongation of life. So not being able to receive dialysis beyond a few days is not compatible with life. And the number of days that they can survive will vary from patient to patient depending on their individual clinical characteristics. But it is fair to say that their lives will be mostly measured in days and not more than that.
You also mentioned yesterday when we spoke about other chronically ill patients who are also facing similar problems. What are the other categories of patients or the other illnesses right now where treatment is becoming difficult in this lockdown?
So we have a very large number of individuals who have hypertension, diabetes, cardiovascular disease, chronic respiratory diseases. They have had stroke, neurological conditions, etc. And they will require care for these conditions for the rest of their life. Most of these people have more than one condition, so what we call multimorbidity. So the kind of treatment that they require includes medications, but they also require additional even equipments. For example, people with respiratory conditions, a few of them might require domiciliary oxygen therapy, so they require oxygen deliveries to come to their homes, and that all of this gets disrupted. If people are reassured that these supplies will be available on a regular basis, they will not hoard, and their confidence in their ability to receive these medicines on a regular basis will prevent them from taking any step that adversely affects the health of others.
Well, as the doctor said, the government needs to open up the supply chain for this medication to these patients as quickly as possible, and also give them transport so they're able to access the dialysis centers as often as they need to. But it's not just those with renal failure. Patients who are recovering from organ transplant, who need regular medication to make sure they don't reject the organs, their body doesn't reject the organs they've received in surgery. India is also the home to the third highest population of HIV positive people who receive medication often from government hospitals. The Niti Aayog needs to relook at the guidelines that it has drawn up for this lockdown to make sure that these people who need access to drugs that saves their lives on a daily basis are given access to those drugs.